back to those days. Then when you add in the compulsory do not resuscitate orders that were placed on thousands of disabled people without asking them, with no underlying health conditions, which sent out the message, you don't even get the right to fight for a ventilator. You won't be taken into hospital.
How did that happen?
How did it happen?
Yeah. How can that happen? How does the system allow that to happen?
So I think people were doing it for the right reason. I think it would, in that at the start of the pandemic, the numbers, and the NHS was swamped. I think the number of people they were expecting to be coming in, they thought they were doing the right thing by making decisions pre-admittance to help doctors who are working on a COVID ward to make decisions about who got a ventilator. So I think there was intention there that could make sense. I think what happened when it was just applied to lots of disabled people, it was like, we have no value in society. And lots of people feel like that anyway, where this was just another thing on top of, the employment gap for disabled people is twice the national average. The unemployment gap, it's just layer on layer on layer. And so, yeah, there was massive pushback on that. But then you look at the figures that 60% of people who died for COVID are disabled. And, the figures from ONS came out recently, and lots of people running around going, oh, this is awful. Those figures were available last year, but there wasn't a lot of pickup from it. And so we do need to talk about the intersectionality of that, because that's really important. But again, it's layer on layer. So it's all that sort of stuff that made disabled people feel not welcomed in society. And again, the bit that you're a Paralympian or you're nothing, it's the haves and have-nots. Or, certainly around the last welfare reform debate and since, it's almost, you're getting to deserving and undeserving poor.